Welcome. You are listening to the ITOT Insider podcast. I'm your host, David, and we bring you the latest insights in shaping the world of Industry 4.0 and smart manufacturing. Today, I welcome Toni Manzano. Toni has decades of experience in managing software projects in the highly regulated pharma industry. I'm going to definitely talk about that as well today. He also teaches courses on artificial intelligence and big data at several universities in Spain. And something I find fascinating as well is that Toni is also associated with the United Nations Industrial Development Organization as an expert in Industry 4.0 in pharma. That is a specialized agency of the United Nations promoting accelerating sustainable industrial development. And Toni is the co-founder and chief scientific officer at Aizon. Aizon delivers GxP-compliant software as a service solutions to the life sciences manufacturers. That's all super interesting stuff to talk about. Toni, very, very happy to have you here today on the podcast.
It's an honor for me. Thank you for the invitation, David.
The honor is all mine. Maybe as an opening question, Toni, as I said, you have so much experience in the pharma industry. Can you walk me a bit and our listeners through your career? Maybe why did you start working in the life sciences industry? What experiences shaped your views, etc.?
Sure. After teaching some astrophysics at the university, I early realized that this is not for me and for my family. And I was involved since the beginning in the pharmaceutical industry, improving critical operations using maths, using advanced statistics. 20 years ago, 25 years ago, wow, the time is going on. And using software, of course, because it's the only way that we could have all these insights. And we started with the first LIMS in Spain. We created a LIMS that was acquired by Siemens. And afterwards, we created an MES, manufacturing execution system, that also was acquired by the giant in the US, Aspen Technology. And that means a lot because this is designing how the pharma works. 20 years ago, LIMS and MES was something wow, and today is also wow, after 24 years ago. So I started in this way.
That's amazing. It's fun to say because indeed today we are still implementing MES systems and LIM systems and all these things, and I also worked with them through my career, and it's fun to say that that even today these systems typically are like, wow, this is next level.
True. And this is what we are facing today. Today we are delivering Aizon Execute is a platform where we are recording the electronic batch record system using AI. Even today when you go to the market is expecting for this kind of software in order to improve their process and their recipes. 24 years later, the request is the same. This is very hard to say or very hard to understand, no?
Yeah. So basically, what you're saying is today we put the buzzword AI on stuff we are doing, but actually we're still working with data. We're still working with mathematical models.
Yes. So I have my own definition of AI. Every time that I go to my classes by the first time, the first day in my classes, all the students are always asking for the same thing. Toni, which is your definition of AI? Because you have thousands of definitions. And the definition that I always saying is AI is like a cocktail with three main ingredients. First ingredient, power computing. Second ingredient, algorithms. Third ingredient, maths. I'm so sorry, but maths is needed. Well, with these three ingredients, you can do a very nice cocktail. But if you want to work in pharma, the fourth ingredient or the secret sauce of this cocktail is the quality data. Quality data. Without quality data, you cannot bring this kind of AI, no? So it's true that we are talking about buzzwords because at the end we talk about power computing, algorithms, maths plus data. And we know that since the beginning of the times. A chemometric method that we use in pharma, chemometric methods are that. Algorithms, maths, computing, and data. The difference is that today, this kind of algorithms plus math plus power computing are more oriented to emulate human knowledge. It's not just to create a model. something that is replicating a part of the real world. Today, we are talking about AI in these terms, how we can emulate, how we can robotize human knowledge.
So, yeah, very nice. This is the first time I'm thinking about AI as a cocktail. Now I do like my AI and I also do like my cocktail. So this is this is gonna work for me. Are there in that long career, and you started, I would say, coding your own MES platforms, and until today, where you're offering software as a service solutions to the same industry. Are there like pivotal moments where you say like these are times or moments or technologies which really shaped the industry or the way the industry embraces digitalization?
Well, one of the most critical steps when you are trying to digitalize industries, and even more, the pharmaceutical industry, that probably is the most conservative industry in the world, is that you need to work very closely with humans. So humans, we have the knowledge about how to do this kind of digitalization well. And this is mainly the first challenge, or the main challenge that we are facing today. In an industry like the pharmaceutical industry, that was presenting 1.6 trillions of benefits, trillions in 2023. Uh,
Wow.
if that works, why to change it? No. So if they are conservative, it's because that works very well with the status and the ground that they have today. They don't need to evolve because they are earning a lot of money. So the increment was 100 billions of dollars in regards of 2022. So
Wow.
it's amazing. So why they need to evolve? This is the main challenge that you are facing. No, you work with people in order to improve their processes, but why they need to improve the processes if they are earning a lot of money? So the challenge here is we have one main challenge today, or main reason is the patient. We 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 need to understand the pharmaceutical industry with two main targets. One is, well, you have to make happy your stakeholders. Of course, business. We are talking about business, but we have a specificity. This industry is serving patients, and we cannot do things in any way. So we have to do in the right way. So these two directions, these two drivers are configuring the both things. Why the industry is earning a lot of money, and why the industry doesn't want to improve or to change what it's already working.
Have you seen over these 2 decades that I would say a difference in adopting new technologies? Has it become faster to adopt new technologies? Is there an impact of, for example, now with the cloud and AI becoming so, I would say, available everywhere? Also, of course, for R&D, because we typically in this podcast we typically talk about I would say the actual manufacturing process, but especially also in the pharma, I think from an R&D perspective, there has also been a huge change in adopted technologies.
Sure, sure. Actually, 2 decades ago, the main challenge was how we can extract, how we can get data coming from the equipment. That was the main concern, no? So we were trying to put some PLCs, Siemens 7s, and so on, in order to connect these kind of things. We put a very big box in order to transform the serial port signals into logic. Well, the thing is that that was the main challenge 20 decades ago, no? How to transform analog to logic information. Today, we have a benefit. The providers of these equipment, they are already providing that by default. So they don't have the pharmaceutical industry doesn't need to ask for this digitalization. They are already providing by default. So this is not a challenge anymore. So the challenge is today is that the society, we talked about that before, the full society is pushing in this direction in order to have more information with more easy access in a fast way. So these three requirements, that is the three B's of big data, now volume, velocity, and variety. So we're talking about a lot of different information in a very high volume, but I need that in a very fast way. These three B's are also are pushed by society. So the problem today, or the main challenge, is that once we have everything digitalized, how we manage that in the three B's of big data, and how we can transform this data into information and the information into knowledge. This is the main challenge.
You still teach courses on these topics as well. I assume that's because you have a passion for teaching. I like that as well myself. But I also sometimes see that there is a big gap between theory, academical theory, so to say, and applying stuff in in practice.
True.
Do you see that the same? How do you try to bridge that theory practice gap?
That's true. That's true. So, AI was born in the 56, in the past millennium. It was born like a scientific discipline as part of the the computing science, and it was completely theoretical. People was doing their algorithms in the notebook by hand with a pencil and so on. After more or less practically 80 years, the situation was the same. So my students are coming to the masters and to this kind of AI degrees, and they have to understand the full algorithm. But it's the same. Do you remember when you were studying statistics? At least once in our life, we need to know how the covariance formula looks like, how the Pearson coefficient looks like, at least once in our life. It's the same. When you know how the random forest algorithm works, at least once, you can rely on that. So the theory is needed like always, but today we have another obligation, let me say, as teachers. We need to show how to do that in the right way, and we need that the students, they make their own reflections. So you cannot teach this kind of good practices. You need to teach how to arrive to the good decisions in order to avoid bias, gender bias, sex bias, religion bias, zone bias. You need to teach this kind of good practices in order that each one applies in their own field, because the fields are completely different.
Yeah.
So this is how the bridge is fulfilling, no? So when I go to my classes, of course, the theory is there, is needed at least once in their life. But afterwards, the best part of the classes is when the students, they think in their field in the right way to proceed with the theory.
Yeah. Nice, cool. It's a lovely way to see it like this, and I also fully agree with the fact that I think you really need to have some theoretical knowledge. You can't just at random start selecting algorithms and filling in parameters and go like, you know what? Let's see. Let's sit back and see, relax and see what happens.
No. This is in this way the pharma doesn't work. In pharmaceutical industry, we need to apply science. At the end, we're talking about scientific things for patients, so it's not heuristically. You have to know what you're doing.
And something I also really like to talk about is I would say the regulations in this industry. FDA, GxP, whatever. Can you, I'd say, for our audience, and especially for the ones who are less familiar with what is a regulation, why do we have regulations? Could you, like, in a very shortly explain a bit more about what that is and what the impact of that is and why we do these things?
Sure. Actually, every single pill that you take when you get a cold, the pill that you are taking, or when you have you get a vaccine, the vaccine that you are getting has been never tested, never. So could you think on that? The pill that you're ingesting when you have a cold, on the powder and so on, has never been tested because it's in the envelope or in the syringe, or this liquid is never tested. So the regulation is required in order to ensure that this medicine that you are getting that has been never tested will work as expected. So there are three main commandments that the regulators or the regulations are looking for when they are approving a drug. The drug must be safety. They have to have the quality expected and the efficiency. The efficiency is very important. So when if this pill that you are getting, this pill is not having the efficiency expected, your ill will be delayed, or maybe it's not held. So these three commandments, safety, quality, and efficiency, are the three main commandments that the regulators need to be sure in every single medicine. So this is why they are there. They need to be sure that every patient takes this medicine when they need, in the right moment, for the right, in the right proportion, in the right situation.
Cool. And maybe to just, I would say, throw a couple of acronyms to you. So if I say GxP, for example.
GxP means good whatever practices. If we talk about manufacturing, we talk about good manufacturing practices. If we talk about laboratory in quality control and so on, we talk about good GLP, good laboratory practices. If we talk about warehouse management system, GWH-P. And we are preparing the GMLP or the GAIP. So this is coming good machine learning practices and good AI practices.
That's something that's being worked on now, or?
Yes, this is working now. Yes, you're right.
Well, that's interesting. That's interesting. And that's maybe also a good bit, because how do regulations or regulatory bodies, I would say, speed up or speed down innovation? What is your opinion on that?
Well, let me share one thing with you. Do you know that FDA, they have all their servers in Amazon in cloud? That's first. Second thing, the FDA was the first one publishing a good practice based on how to use AI as a medical device. For example, in 2023, we had, by the first time, the first guidance from the FDA about how to use AI in drug manufacture. So you can Google that and you will find. The EMA. The EMA published the reflection paper on AI for medicines life cycle also past year. And even more, they are not just publishing the guidance and so on. That's all. First of all, they request the feedback coming from the pharmaceutical community, and with this feedback, they improve their guidance. So it's an open discussion, and this is, let me say, I feel very proud about the regulation that we have nowadays, because they are taking this responsibility. They want to provide all the things necessary and in place in order to be sure that the patients are held and are managed in the right way, in their own way. So they are first.
That's an interesting insight. This probably to make I would say a step towards validation of ways we work. So I think in many industries, but especially in the pharma industry, when we implement a certain algorithm, when we implement a system, when we implement a control loop, etc. And you already mentioned that we want to make sure that if we produce a pill or a vaccine or whatever we're making, that everybody who is getting that pill or that vaccine from that batch gets it in a controlled manner. And that means that the way we, I would say, build software and build hardware in these manufacturing plants needs to be validated.
Right.
And I also just want to bit more on your experience on validation, also the why, the how that also changed over the last years. I assume because a while ago, validation was really, you had an engineering diagram and you just you saw like, okay, if this happens, then that happens. Okay, validated. But now also with software, that becomes really more, it becomes more complex.
More
I assume.
complex. Yeah, you're completely right. You know, in one of the biggest drug manufacturing sites in Spain, I cannot say the name. The 25% of the staff are validation people, quality people.
Wow.
25% of the staff, and this is increasing the price of the drug, and this is why the price of the drug can be increased. Okay. Well, the thing is that in the old world, let me say in the 20 years ago, the CDs and the DVDs were fully controlled by the validation team. No, they can control in which computer this CD has been installed. I can see the version. I can stamp my signature. No one can do that in another way. Today we are talking about a completely different thing. Everything is in cloud. No one knows when Microsoft Teams is changing the version, when Amazon is modifying some services. Amazon is updating their services every 5 minutes. Some of their services are already updated every 5 minutes.
Yeah.
How I can control that? No,
Yeah.
in the static world, that validation team, the CSV team, the computer software validation team, thinks that we're thinking on something static. The validation that we're talking about 20 years ago and today is based on static assumptions. Everything is under control in my CD, my DVD, no one can change it. The regulators, the regulatory bodies, they are already aware about that, and they want this change. They promote the innovation, they promote the modernization of the pharmaceutical industry. You can make a Google FDA modernization industry, and you will see a lot of papers requesting to the industry to be modernized. But you cannot do that with the classical approach. Everything is static. So for this reason, they created the new concept, CSA, computer software assessment, no validation, assessment. That means if you see the difference, you will see that the main difference is that you need to put inside the validation concept the risk assessment and the human rationale on top of that.
Yeah.
And this is one of the main problems in the industry. In the industry, classically, everything needs to be considered as static, nothing change. And in the real world, everything changes continuously.
Mm-hmm.
How you can, so the validation teams were always trying to avoid this kind of continuous variability. But the variability is per se in everything. Teams are changing, my equipment is changing, my provider is changing, the decision are changing continuously. So the classical approach for pharmaceutical industry are that everything needs to be under statistical control, variable by variable. What happens when a variable change? The other ones are already immediately affected. But I'm very happy once all of them they are under control. But no one was taking care of the real essence of the nature of the changes, because it's so complex. When you talk about biopharmaceutical industry, you're talking about vectors that they are putting in a bioreactor. This is alive. You cannot control alive things. The only way is today is putting something really smart on top that is able to understand what's happening. So I have, and I don't know if I'm very long, but let me explain this experience. It's very nice. I was completely surprised when I entered in a big pharmaceutical industry with 1,500 liters bioreactor doing insulin inside, and I entered with the director, and he was an old man, and this guy said, "This smell not very good. This batch is not going well." But all the sensors were saying that my batch is going well. This guy was able to condense all the information, all the sensors, pH, density, temperature, humidity, the sugar, blah, 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 in only one observable. How that smells. So I think that this is the concept of AI. Today with AI, you can aggregate this kind of reality, complex and variable reality, in something that is understandable by a complexity mind that can be a human or can be a machine. The problem is that if this guy goes in by vacation in vacation and holidays, no one knows that is going wrong.
It's amazing how experienced people they have so fine grained understanding of what they are making, and it is so difficult to grab that knowledge into a system.
Completely agree. So why they can do it? Because they have of course experience, but experience means a lot of data with a lot of rationale behind that. So if you try to simplify that with data and rationality, and we can emulate that with maths and algorithms and power computing, we have AI, but 24/7. This is the difference.
And it also clearly shows that just applying a black box model, we get some data and we'll feed that through algorithm A, B, or C, and we expect something to come out of that is it's not going to happen. It's
Yeah. I can ask you something. Please don't say black box in the regulatory world, because this is completely forbidden. No, black box means that you don't know what happens inside.
Yeah.
And the regulatory bodies, they only believe or they only accept models that has been created understanding what's happening inside. So you need to demonstrate that you have everything under control. For the reason, the black box at the beginning, when AI was a black box, as you say, because we have
Yeah.
a neural network with some hidden layers, I don't know how many, with some input cells and so on. Today, we are very lucky because the community is working and is creating standards, for example, like ONNX. If you look for ONNX, Open Neural Networks, you will see that there are systems that they are able to transform black box into transparent box. So
Wow, that's interesting.
yeah, and graphically, and they are open source, and these tools are open source and also graphical. So you see how the input is going in the machine in the all black concept. You see how the neurons and the weights in each layer has been assigned, and you see the output, and everything can be traced, and everything can be exported. No, so it's not black box anymore. At the end, we have a transparent box that can be accepted by the regulation.
Interesting. So here again, and you mentioned a couple of times, but you always talk about this, how can we push innovation? How can we keep on taking steps in this sector? And what I also mentioned in the introduction, Tony, is that you're involved in the United Nations Industrial Development Organization, UNIDO, in short. Um, how did you what does that agency do? What is your involvement?
Sure, sure. In the United Nations, they organize missions. In this case, in UNIDO, UNIDO is a branch of the United Nations dedicated to develop um, good practices and to promote the industrialization in medium developed countries and underdeveloped countries. Okay, and they have missions, and in these missions, you participate as an expert in order to help to these countries, because at the end we are talking about countries: Slovenia, Cuba, Africa, South, Africa West, and so on. You contribute with other experts in order to promote their industries. And United Nations, they are completely convinced. They believe that AI is a tool. AI and digitalization in general is a very good tool to democratize this advance, this evolution of the industry. There are countries like Cuba, for example, that they are completely isolated by the American laws and so on, no? But they are extremely powerful, believe me. They are so good. They don't have access to Amazon, they don't have access to Google, but they created their own cloud. And they are amazing creating AI systems that they are advancing a lot in terms of drug discovery. For example, the COVID vaccine that they created by themselves was a success vaccine, and no one's know that. So we only know Moderna, Pfizer, and AstraZeneca. No one is talking about the Cuban vaccine, and it was amazing. It works very well. So they are very advanced. So this is an example about how United Nations are supporting these countries in order to help them to be promoted. And United Nations believes that digitalization in general and AI are fields that can help a lot. Can help a lot.
So that's then I would say, that's the mission, is to, I would say, be a knowledge body,
Knowledge
transfer knowledge.
well, knowledge body, and also to find out potential relationship between countries. For example,
Yeah.
if you find a country that is very good in something, another country that is very good in other things, or they have the opportunity to work with Europe, for example, why not to work together? No, this kind of thing, this kind of collaborations are working very well, very well.
Cool. Hey, and I also just wanna, of course, touch your company, Eisen, which you co-founded. Uh, I assume that you started with with founding Eisen because you identified a certain gap in the industry, something which wasn't solved yet.
Yeah, yeah. So 20 years ago, were the same three co-founders. We have been working in other iterations previously, and we know each other, well, since I was here. So after 24 years, we found that we were living, by the first time in the history, a special moment. It was how the cloud computing was completely democratized to everyone. So do you remember when you had these external hard disks close to your computer in order to make your backups and your pictures with all your holidays and so on? So the the price for 1 GB encrypted, backed, and with replication in multi-region is 1 cent per month. That's nothing. So this is the most amazing democratization around the world for data and data access. No? So we believed on this change 10 years ago, and we went to Silicon Valley, and we arrived to an agreement first with Google. They didn't believe in the life science vertical, and for this reason we went to Amazon, and we created this kind of partnership with them. And that was because it was the first time that we had all the technology in our hands in order to comprehend the complexity and the continuous variability in the pharmaceutical industry. Always in the pharma industry, everyone with the recipes, with the old patents and so on, we are looking at the processes in a very limited way. We're humans and we only see in 3 dimensions. So we only see 3 parameters at the same time, always within limits. But we knew for all the previous experience 20 years ago that the reality is more complex and is continuously varying. How to tackle that? Not from a scientific perspective, but based on the data that we have. And for this reason, we went to Silicon Valley to found this agreement. No, and the problem to solve is how to understand complexity in a scientific way.
What are I would say, the typical type of problems you solve for your customers?
Well, everything that is related with a problem that cannot be solved with the usual tools that they are using. So all the customers that we have, they are amazing. They have a fantastic statistical teams with a very knowledgeable teams. But again, the problems are complex. And let me explain you a problem. For example, in the pharmaceutical industry, when you work in chemistry and your raw material is coming, you analyze the raw material, you analyze this density or this color, or analytic quality attributes, and you can say, wow, this is not compliant with my specification. You can say no to the provider. Supplier, Mr. Supplier, I need another batch that is committing with my specifications. But now imagine that you work with human plasma and you transform human plasma into something. Okay? You cannot say no to human plasma. Human plasma is gold because it's coming from donors. So when you work in medicine, in drug manufacturing, and your raw material is blood, this is gold. In whatever state it arrives. So this company, and I cannot say the name yet, but well, you can imagine there are not too many companies dedicated to human plasma. No? When you are receiving this raw material and you see that the final product that you're doing are decreasing the yield of the processes, you cannot do anything because the raw material is there, and you know very well your process. You're very knowledgeable in all the operations that you are doing. How to tackle this kind of problems, no? Well, and this is very complex because you are centrifuging this plasma, you are filtering, you are centrifuging, and you are transforming in different phases these subsequent products that you have coming from the original one. But if the original plasma that you are getting is not good, the final yield is not good.
Yep.
And you have to be applied these recipes that has been patented. Okay. Well, how we can help on that? AI is able to understand the complexity between the quality attributes of the raw material, the quality attributes that you expect from your final product, and all the critical process parameters in the middle. So we're talking about hundreds of parameters. So it's not possible for human perspective.
No.
So when you put in place AI and you have very good data, quality data, remember the secret sauce of the cocktail, and you have this quality data working and transforming this reality, this complex and variable reality, in something that is understandable, you can act on the process in order to know which is the perfect speed, the perfect filtration process, in order to have operation by operation, phase by phase, at the end, the final expected yield. This is an example that I can share with you because it's amazing.
It's absolutely, it is amazing, and it also has a real tangible impact. There is only so much plasma available.
Of course.
Is there also the role of IT/OT convergence? So on the one hand, your operational systems, on the other hand, more the IT world. Do you see the gap closing in the life sciences industry, or do you see the gap staying the same or even becoming bigger?
No, I think that the gap is being filled in part because we have two main reasons. One is, as I talked to you before, the society is pushing, but the second one is the executive levels. They are being replaced by young people. Young people like you. No, believe me, this is a problem. When you have a chief executive officer, a top level, that they don't understand how AI works, or they are not working or they don't believe on what they are doing with digital, because my industry is earning 1.6 trillion per year, so I don't mind. But when this generation is being replaced by young people like you, they understand and they live every day, every moment with that. So it's not something strange. It's something that it's needed because I live with that. You know, when people is coming to me and they say, well, my data will be in the cloud. I don't believe in the cloud. Why my data is in the cloud when I have all my recipe, all my pH during 24 hours in the cloud? Someone can store that, no? And I always say, do you know where is your money? Which is the last time that you went to the bank, the physical bank office? I don't remember. So if the money is in the cloud, how you cannot rely on your pH on the cloud, no? So this mindset is changing because people like you is getting this kind of executive level. So this is the gap that is filling.
Interesting. And Tony, you seem to me like a guy who does have kind of a glass bowl. And so I just want to, I would say, to end this podcast by asking you this, I would say, this broad question. How do you see, especially in your industry, the I would say industrial digitalization, IT/OT convergence, whatever name you want to give it? How do you see that changing in the years to come? What are the things we're going to see? What are the things which are going to happen?
Mhm. In 2003, Tim Menzies is one of the fathers of AI. He was old in 2003. He said, in the future, so now, AI won't be a hype anymore. AI will be a commodity. So I see the life science using AI and using digitalization because the curve of the innovation. So at the beginning of the innovation is like a Gaussian. At the beginning of the curve, you have the early adopters, people that is risky and they buy an electric car. But in the last time, in the last part of the Gaussian, we have the laggards, adopting innovation. So it's just a matter of time. So in the future, in 5 years, the pharmaceutical industry will adopt by necessity because everyone is doing that AI. So there is no way. So we have to get the bus or get the bus.
And I like this. I like this final outlook. Tony, thank you a lot for joining this conversation. I really enjoyed it. Um, uh, Keep on doing the work you're doing. It's amazing. And to our listeners, thank you for tuning in. You can find more episodes on itotinsider.com. Till the next time.
Thank you so much, David.
Thank you.